My name is Scott Ellis. I'm an orthopedic foot and ankle surgeon at the Hospital for Special Surgery. The kind of patients that I see are anybody with a variety of different foot and ankle pathologies or conditions or injuries, and those include anything from trauma, things like an Achilles rupture, ankle fracture, trauma to the midfoot where somebody breaks the bones or dislocates their foot called a Lisfranc injury. I also see deformity, things like a bunion that we fix surgically or a flat foot that needs a reconstruction. And finally, arthritis in various joints of the foot and ankle. For example, in the ankle, patients have arthritis after a broken ankle that may need a total ankle replacement, and also arthritis in the big toe, which is very common, and there's a variety of different surgical procedures that we can use to address a painful big toe. The right course of treatment for each patient depends on many factors about the patient. It depends on their age, their health. It depends also on what the problem is. There are some problems that will just get better, mostly with time without surgery. There's other problems that tend to just slowly get worse. For example, plantar fasciitis generally gets better on its own. Conditions like collapsing flat foot tend to get worse over time, and then we follow those patients, and ultimately some of them need to have a flat foot reconstruction. In the case of an ankle arthritis, many will need to go on to have an ankle replacement over time. And we also use a variety of imaging to help us decide what the right treatment is, and that includes x-rays, commonly a weight-bearing CAT scan at our hospital since we have that technology, and MRI. The advantages of the approaches that we use are to really relieve pain and improve function, and we always start with conservative measures first to make sure something's not just going to get better on its own or something that we can just treat without needing surgery. The advantages of surgery are then, when we know the odds are greatly stacked in our favor, is to help patients have a better outcome, more function, and less pain. When a patient comes back after surgery and they're happy, successful, and doing well, it's probably the greatest feeling that we have as an orthopedic surgeon, particularly in foot and ankle. So just being able to see somebody that tells me and you can see that they're doing much better than before surgery is very gratifying.